Hey, everybody, welcome to That Expert Show, where you help run the show. I'm Anna Canzano. Thanks so much for joining us as we're talking now about acupuncture for fertility. Fertility can be a pretty arduous journey. When you start to try to make a family and start a family, it doesn't always happen right when you want it to. There can be a lot of challenges along the way, and not to mention with pregnancy and labor, those can be pretty intense experiences for women. And guess what? Acupuncture can help. Joining us live to talk about this is the clinical director and owner of Blossom Clinic, Liz Richards, joining us live on That Expert Show. Liz, thanks so much for being here.
Hi, thank you for having me.
Let's begin by just talking about fertility as an issue, because I think that based on
Mhm.
your experience with 20 years in this field, you are seeing that fertility is on the decline.
Yeah, that is true. It's always been pretty bad, I'll be honest with you, but it is declining, and we are seeing that. Just this week, I've seen a lot of sperm analyses that are, pretty low in count and motility and morphology. Um, Most of my patients are female. I specialize in women's health and fertility. And a lot of my patients are undergoing IUI or IVF. I would say about 60% of my fertility patients are trying to conceive with Western medicine's help, and 40% are trying on their own. And, when we think about fertility and these procedures, these, IUI and IVF, we think a lot about physical aspects of it, like the medication that needs to be taken and the shots and all of the appointments. And what surprises a lot of people is the mental health aspect of it and how hard it is and how stressful it is to go through these experiences. So with the decline of our fertility, there's also this need for like teams of practitioners to help these patients get through this process that's really challenging.
Yeah, I would imagine, that it's really emotional because for people who are trying
Mhm.
to get
Yeah,
pregnant and it's not happening literally every month, you are riding the roller coaster of, okay, we're going to try to do this. Did we get pregnant? No, no, we're not. Or you can,
yeah,
there can be loss along the way with miscarriages and, you know,
exactly.
after a period of time, like the willingness to
hmm
go on can also be challenging.
Yeah, and there's a lot of paths to obtaining having a child. And sometimes, part of my job is, helping facilitate that process of helping people, figure out what they need to do, what labs they need to get, what doctors they need to see. And that helps relieve a lot of anxiety too. When people come into Blossom Clinic, they say all the time that they feel like it's a sanctuary, that they can come in and really relax and rest, and that really is a big part. It's an opportunity every single week for them to get on the table and really just, and also come as they are, right? No matter what is going on with them, they can come as they are, and they can, let that all out also when they're here. And, I think a lot about my patients' vulnerability, and it's really beautiful. Their vulnerability is beautiful.
From a physiological sense, how does the acupuncture actually help with fertility?
Yeah. So the acupuncture, so what we do is more than just the acupuncture. The acupuncture is probably about 30% of it. Um, when we patients come in, we do a full health history, and I'll feel their pulse and I'll look at their tongue. That's part of our objective diagnosis. And then we come up with a treatment plan. And the treatment plan includes weekly acupuncture. And the acupuncture points are on certain places of these channels, these energetic channels that run through the body. And some of them make sense and some of them don't make sense. Like, you would think that the acupuncture points are mostly on the abdomen or over the uterine and the ovary area, but there's actually points in other parts of the body that are used for fertility. Like, we have a point right here on the wrist that's called master of the conception vessel. And when we needle this point, it actually accesses the energetic channels that run through the uterus and the ovaries and help increase blood flow in those areas. Um, so the acupuncture, the best way to think about it, and it's a hard thing to explain, like in Western medicine, we have the nervous system and we have the circulatory system. And those are very tangible concepts that are relatively easy to explain. But when it comes to Chinese medicine, we have these energetic channels running through our body with qi flowing through it, which is our energy, and also blood. Blood is different than the Western medicine blood. And if you think about it, I'd like to think of a river analogy when I think about acupuncture. And the chi is flowing through the channels, just like a river would. It would nourish the areas that it needs to get to and all the animals and the plants around. And then if you imagine that a tree fell along the course of the river, the water would start flowing places where it has never been before, and it also deprive areas that it was before. And that's kind of like the chi. So when we put the needles in, we're like adjusting the chi in those areas. We're increasing it where it's become depleted, and we're decreasing it where it's become too excess. And it is amazing medicine.
Can you back up for just a moment to what you said about when a patient comes
Yeah.
in and you look at their tongue? I'm fascinated by that. What is the tongue telling you about their whole
Yeah.
body health?
So I will tell you that I love tongue diagnosis. And I also think it's really funny when someone is taking a photo and posts it on social media with their tongue sticking out. My kids always laugh because I'll start analyzing, what their deficiencies are based on their tongue. The cool thing about the tongue diagnosis is that we can see change. So, a patient can come in and, the first thing that we look at is the base of the tongue, like the color. Is it red, which is heat? Is it purple, which is stagnation? Is it pale, which is deficiency? A healthy tongue is pink. Then we look at the shape of the tongue. We look at the coat, see what color it is and the thickness. And then as patients get treatment, through the course of the weeks that they're coming in, you can really start to see changes, and you can see that their body is getting healthier. It's pretty cool.
And the ideal tongue color would be
Is
what?
pink.
Is just pink.
Pink, which I don't really see that often, I will tell you. Yeah. The classic Portland tongue is kind of pale and puffy and has like teeth marks on the edges. We call it scalloping. Um, I know that sounds so strange and sounds strange saying it right now, even though I talk about it every day. But we do live in a damp climate in Portland. So I see this kind of tongue all the time.
I'm going to go down a deep rabbit hole and read more about the whole tongue thing. That's fascinating to me.
Yeah, it is really cool.
So, like, help me understand when it comes to acupuncture, because I mean, I think on the West Coast, there's a lot more acceptance
Hmm.
of acupuncture. I think across the country, it's becoming more part of people's regular vernacular. It doesn't seem
Absolutely.
so like woo woo anymore. But I think particularly on the coasts, it's a little more common and accepted. But I think there might be some
Hmm.
people that are a little hesitant to even try it. A, they don't like needles, they think it hurts. Or B, for somebody who is
Hmm.
considering fertility, and a woman who's trying to get pregnant is
Yeah.
probably more paranoid than the average person who's like, well, if I've only ever experienced Western medicine and I'm actually seeing a fertility doctor and trying to get pregnant and doing shots in my stomach to try and increase my follicle count, is the acupuncture actually going to be detrimental? How does the
Hmm.
acupuncture integrate with Western medicine?
Yeah, that's a great question. So a good practitioner is going to work collaboratively with any Western doctor. And so, there's room for everybody. And actually, you want everybody because the team is really important. No practitioner can do everything on their own. So, you have to acknowledge that first and foremost. Any practitioner or doctor who says that you don't need all these other things probably, has a big ego or something because you really do need the team. So, I've been working with reproductive endocrinologists, for example, in the whole course of my practice for 20 years. I was on the acupuncture team at ORM Fertility. We have three big fertility clinics here in Portland that we work with. So there's kind of like these unspoken agreements. There's certain things that I respect from the doctors, like when it comes time for injections with IVF or IUI, I usually stop the Chinese herbs. We continue the vitamins and supplements, but we'll stop the Chinese herbs. And we actually get a lot of referrals from reproductive endocrinologists because of that, because they know that we're going to work well together. Yeah, and it's not anything. You know, a third of my practice, I would say, is the acupuncture. A third of it is this clinical aspect, and that involves, you know, working with other doctors and figuring out what labs they need to have done and analyzing those labs and really like facilitating this process in Western medicine. And then a third of it is a little bit of a mystery, right? There's an element there that is hard to explain, and it's you kind of, in a way, just kind of have to surrender to it and accept it and understand that you're not going to understand everything that is happening. But I promise you, it's not anything funky. Everyone's sleeps on the table, they rest, and it's super relaxing.
Yeah, I mean, I think just the relaxation alone uh, would be helpful for a lot of people that are trying to conceive. Can you give us some insight into the supplements and the vitamins that you're
Yeah.
mentioning that can help with fertility?
Yeah. So the with the supplements, I at a minimum, I like my patients to be on a really good prenatal and a really good fish oil. So that's kind of where we start. That's the foundation. And I took one out right here, brought it out. This is our Thorn Basic Prenatal. This is what I recommend. It's the same price everywhere. You can get it on Amazon. And then for fish oils, I like Nordic Naturals Prenatal DIJ. I feel like an ad right now, but this company is amazing because they third party test. You always want to take supplements that are third party tested. With Nordic Naturals, you can actually go on the barcode and you can trace the batch of fish that they got it from. So it's really important to take brands that are third party tested. And so we start there, and then we'll build up after that, usually based on labs. So where the person is deficient and what is going on with them, like vitamin D, is their ferritin low, which is their iron stores. And then we look at their Western diagnosis. So if somebody, for example, has endometriosis, we're going to look at reducing inflammation. If someone has polycystic ovarian syndrome, we're going to give supplements that are known to help regulate their cycles and regulate blood sugar, for example. So it's just this like process that we go through. And my style is to actually consolidate herbs. Like if somebody is coming in with vitamins, I mean, and they're on 20 supplements, I'm going to work on actually consolidating the supplements and figuring out what is the most important things that they should be on and take out the things that they shouldn't, because it's not okay to be on that many supplements. And then the Chinese herbs are really cool. So we break up the menstrual cycle in up to 4 parts. This is my style. So I will break up the menstrual cycle in up to 4 parts, and I can give a Chinese herbal formula for the time during their period. I can give a Chinese herbal formula for what we call the follicular phase, which is pre-ovulation. I can give an herbal formula for the ovulatory phase, and I can give an herbal formula for the luteal phase at the end. Most of the time, I give people 2 herbal formulas, one for the first half of the cycle and one for the second half. And it's just a really lovely way to help regulate the menstrual cycles and get it back on track and help people ovulate. And helping people ovulate and have a healthy ovulation is really important in fertility. And when you talk about the decline of fertility, going back to the beginning, there is a decrease in egg quality and egg quantity in women. And I'm finding that it's becoming, people are younger and younger with this declining fertility. And so we give supplements to help basically like improve the quality of their eggs. We can't increase the number of eggs, but we can increase the quality of the eggs. And we definitely see that in our practices.
With the Chinese medicines that you are
Mm-hmm.
administering to clients or patients, are
Mm-hmm.
those affecting, like when you're talking about how it's actually impacting the body? Is it impacting like the endocrine system of the body, like the hormones in the body, or what impact is it
Hmm.
actually having?
Yeah, I mean, they can have an effect like that. They can affect the hormones, which is why sometimes we don't use the Chinese herbs when certain drugs are being used. Sometimes they can actually help. They can like enhance the hormones in a certain way. But yeah, that is one component of it for sure. Um, but it's not the only thing that they're doing. Yeah, and I think in Western herbs, they use one herb at a time really commonly, but in Chinese herbs, the formulas are made of multiple herbs and they balance each other out in a lot of different ways. So it's like the formula is what is key.
For somebody who's interested in, enhancing their health with either
Hmm.
acupuncture or supplements or Chinese herbs, like, especially in our area, there's a lot of options to go seek out. And so, what
Yeah.
would be your advice on, what is like the baseline distinction that somebody should have when they're trying to select a provider? Because
Yeah.
I would think you wouldn't want to just go to anybody. So, how do you even evaluate providers?
So this is why I offer free phone consultations and always have, and I'm not going to get rid of them because I think that it is important for the person before they make their first appointment to really see if the provider is a good fit for them. And otherwise, it's really hard. I mean, I have patients come to me because they're word of mouth, either their sister, friend, someone else that they know thinks that they should come see me, and or they're getting doctor referrals. Sometimes they're getting it from multiple places, but if they're not having a direct referral, like how would they know if it's going to be a good fit? So I do free phone consultations. um, we say on the website that they're 10 minutes, but they usually end up being about 15 minutes, sometimes 20 minutes. And it's a lovely opportunity for us to see if we're a good fit for each other. The new term for it is a discovery call. And I see a lot of times on Instagram, business coaches saying that we shouldn't do free discovery calls anymore because it minimizes the brand. And I completely disagree. I think that these, complimentary consultations are, they're wonderful, and it really helps answer the questions that people have. It gives them a sense of security and knowing that they're taking the right step in their health journey.
I want to thank folks who are joining us live right now via the Oregonian
Mhm.
on Facebook. If you are watching, feel free to post a question if you've got one. I know that Liz would love to answer it for you. I am
Mhm.
monitoring the feed and would love to get your feedback on what you think of this interview right now. I know that part of your services that you offer at the clinic too involve pregnancy and labor. And
Yeah.
that's like hugely valuable because there's a lot of things when it comes to pregnancy, whether it's nausea in the first trimester or back
Mhm.
pain or all kinds of things that your body is going
Yeah, all of
through.
that.
Yeah. How does the acupuncture help with that?
Yeah, so a lot of our patients see us for pregnancy after they've gotten pregnant, coming to us for fertility. So they'll continue through the first trimester and come in for nausea and fatigue. And also, if they've had a history of pregnancy loss, we also have points for that. So that's what we do in the first trimester. Um, and then in the third trimester, second trimester, patients do continue to come in. Sometimes they'll come in as needed. And then in the third trimester, it's really interesting because we're treating, basically helping the person prepare for labor. And we'll start with helping the baby get into the right position. If the baby is breech or malpositioned, there's actually a point that we can do moxibustion on the pinky toe. And moxibustion is an herb that we burn. It's also called mugwort. And we burn it over the pinky toe or the corner of the nail, and it can help flip the baby into the proper position. So I just had a patient this week who I helped turn her breech baby. And it really it's amazing because it helps prevent interventions later on. and also allows people to have, have a higher chance of having the labor that they want. We all know that, nothing is guaranteed when it comes to labor. So we start with the baby's position, and then once the baby's in a good position, we'll do points to help the baby descend in the pelvic cavity, and then there's actually points to help soften the cervix, and then stimulate contractions and help the woman kind of like have an easier transition into labor. It doesn't work as well if the person comes at the end of the pregnancy and tries to come in just for labor stimulation, like if they're past their due date. It works better if the person actually starts around 34 weeks.
That's really interesting. And you probably have a lot of people that are coming, sort of last minute, like pregnant women are,
I was like that.
we're a little frenetic. We're in the midst of like pregnancy and nesting and trying to get ready for the baby. And like, I think a lot of us grasp for different things as we're pregnant. Like I had never, ever gone to a chiropractor before, and I started going to a chiropractor while I was pregnant, and it helped tremendously. So, but I think what I hear you saying is that it really helps if patients can try to establish that care early on with you and have more consistent visits with you prior to the big day.
Yeah, absolutely. And the same goes for IVF. Like, when I started my practice, a lot of patients would come in on the day of the embryo transfer only, but we all know that it's really the appointments leading up to it. It's like the 3 months prior, the 4 months prior that's going to help the most. And the same goes for pregnancy and labor. Yeah. But we do what we can. I have had patients come in at, there's a woman in the neighborhood. I see a lot of patients that are like former patients of mine, because I live in Northeast, and, we see the same people over and over again. But every time I see her, we laugh because, she came in one night, her husband had the flu, and she said, I can't go into labor tonight because my husband has the flu. And I was like, okay, I'll make sure, I won't do any points, and actually like tried to do the opposite, like hold on to the baby. And then she came in 3 days later and she's like, okay, I'm ready now. He doesn't have the flu anymore. And I was like, okay. And we did our needles, and then she went into labor like after she left, that night. So it does help sometimes, but those are mostly the exceptions.
That's incredible. I want to thank Sharon for sharing her story. She's saying that she found out that she was infertile in her 20s and had lots of tests done. Almost 8 years went by, and they finally figured out why. After taking fertility pills for 3 years, they gave her estrogen, and she was pregnant in 1 month. This was 1986 and 89. She had a girl and a boy. It's so hard to go through when you wish for children, and she was glad that she was finally able. I mean, that's the kind of story that I'm sure you hear over and over again, and it must be so gratifying to you to be able to help women.
Yeah, I have the best job in the whole world, and my patients are amazing. They're intelligent, motivated women, and they're vulnerable. And I feel really lucky. And I used to have a lot of baby visits pre-pandemic where my patients would bring their babies to the clinic, but I've only had 1 or 2 in the last 2 years. So if any of my former patients are watching, please bring your babies by. Thank you.
Well, I would imagine in 20 years that some of your babies are now not babies anymore. They're like in college.
Yeah, they are my oldest blossom babies, which I call them. They're seniors in high school right now. So yeah, which is also cool when I see them around the neighborhood as well.
That's so great. Well, thank you so much for your insight into all of this. We'll be creating a tip sheet summarizing all the key points that you covered, and obviously let people know how to get in touch with you and have a free phone consultation with you. Any last thoughts before we go?
Yeah, I'm going to start going live on Instagram, and it's going to be a really cool opportunity in addition to the free phone consults for people to just ask questions. I'll probably come, with topics every week, but questions are completely welcome.
That's awesome. Great. We'll let people know how to watch those as well. All right. Thank you so much, Liz.
Yeah, take care.
Thanks for joining us for this episode of That Expert Show. Man, like I said, we will put that tip sheet on thatexpertshow.com. And, you know, we always put our episodes out on YouTube as well, so you can check out our YouTube channel and see all the previous episodes that we've done. If you prefer to listen to your content, we also put our show out as a podcast. So wherever it is that you listen to your podcast, just search for That Expert Show. And hey, I love hearing from you. I'm serious. You give me the best ideas on what topics to cover, what guests to book, and what questions to ask even. So reach out to me. I love to hear from you. I'm on Facebook, Twitter, and Instagram. Just look for Anna Canzano. We are live on Monday nights in partnership with The Oregonian. Thanks so much for being part of That Expert Show. It's where you help run the show.